Let this occasion serve as a call to every Filipino to continue doing your part, get updated on your COVID-19 vaccination to prevent the resurgence as a means of honoring those who sacrificed their lives during the pandemic. I urge all of us to remain relentless in our fight against COVID-19 and all other infectious diseases that threaten the country. As long as we exhibit discipline, observe cleanliness, and practice cooperation, we will overcome the residual challenges that still are posed by the COVID-19 and emerge stronger than ever as members of a healthy, resilient, and productive Philippine society.
The bivalent vaccines are the latest vaccines that contain the sub-variants of Omicron. No? In the earlier vaccines that we got the previous years has been what we call the primary vaccines, which contain the earlier variants of your COVID-19 virus. So now we've got the updated latest variant, so they call it bivalent compared to the previous one, which is monovalent, which just had the previous. So this protects us from the newer outbreaks of Omicron that has been happening in different parts of the world, and it also helps update people who have already been vaccinated. So who gets to be vaccinated? I think the people that need this, for now we will, because our supply is still 390,000, we're still waiting for the subsequent acquisitions of these vaccines. We are limiting it to the senior citizens above 60 years old and the frontline healthcare workers. The requirement is you must have had your primary 2 doses and 2 booster doses, and more than 6 months after that last second dose. So last booster dose. So those are the people that will be vaccinated. We've distributed most of the vaccines, and nationwide, other centers are also already deploying the vaccines to this particular population. We're actually in the end game in the fight against COVID-19. As you very well know, our activities have already been all normal, almost in the new normal. We continue to wear masks at high-risk positions, but we do not mandate mask wearing. We continue to monitor outbreaks or clustering of cases, although our test positivity has been going down for the past few weeks. But that doesn't make us stop from vaccinating everyone with the updated bivalent vaccines. The Department of Health has been with the Filipino people in this fight against COVID-19 since it started in 2020. I was special advisor to the National Task Force before I became Secretary of Health, and I was actually part of the vaccine cluster that really deployed to get over 70 million Filipinos get their vaccines. And because of that, we're in a situation that we're able to move around. The virus hasn't disappeared. COVID-19 is still around. Just like influenza in 1918, we still have influenza today, but in a milder form. And that's what we have. So our people need not be scared. The later variants of Omicron are less severe. It's mostly like an upper respiratory infection, 2-3 days. But people are at risk, like the senior citizens, the elderly, and frontline workers. That's why we're giving them priority for the bivalent vaccines.